I'm going to actually call on stage today somebody who I would call one of the most loved doctors of India. Every time you ask or you talk about women's health and you say, okay, who's doing some good work in it? And you think somebody is going to talk about a female doctor. Everybody mentions the same doctor. And that doctor is a doctor. Some of you might be familiar with his name. Others are going to meet him this time. That doctor is Nozer Sheriar. I want you to put your hands together to welcome Dr. Sheriar on stage. Can we have him on stage? Always a pleasure. Always a pleasure. Can we show Dr. Sheriar some love? I really think he's the most popular doctor that everybody, every time we do with We the Women, we have a request, please can you get Dr. Sheriar, no matter which city of India we go to. So he's that popular and that loved, and that's how much women in particular trust you. And you know, all day long, we had Vinita Bali here on stage and she said, you know, we need Renaissance men. And I think in the next hour or two, we're going to be meeting a number of Renaissance men, and one is sitting here. How did this journey begin for you that you became such a passionate advocate for women's health, Dr. Sheriar?
It starts with having the right parentage. I had a great mother and a father, but my mother was one of the most sensitive, caring doctors in government service, but sensitive and caring. And just seeing a great woman, you get inspired.
What would she tell you when she was bringing you up?
I mean, you were being brought up right, but at the same time, when it came to looking after my patients' women, her favorite quote was, the best thing about care of the woman or the patient is caring for her.
Yeah.
You go into medical college not knowing what you want to do, and you go through the different terms. And the first time I saw a baby being born, I said, that's what I want to do for the rest of my life. Get up in the middle of the night and...
Feel free to clap.
So my specialty, gynecology and obstetrics, thankfully, I always say I only have to look after women. I consider so important because it's one specialty which gives us the opportunity of caring for someone through life. There's no one who cares for men through life.
Yeah.
We care for women from adolescence through their reproductive years, right through the midlife. We look after everything. And that's such a great opportunity because I personally believe that there's so much we can do when you look after women.
But you know, I want to share some data points that I was reading today. I don't know how many of you know, but only 37% of Indian women have access to healthcare. It's not an equal access at all. And the more startling data point was that women between the ages of 15 to 49 a majority of them surveyed said that they were not taking decisions for themselves over their own bodies. I mean, that is just shocking. How have we reached this point, Dr. Sheriar?
You know, it was even worse, and what you're quoting now is probably an improvement on what's happened over the years.
Yeah.
And I'm just looking forward to the time we're demanding that from.
Yeah.
The other thing is also the fact...
Go ahead, you can show your emotion.
You know, most countries in the world are so proud, and do you understand, I once saw a statistic which said that if you just took a few aircraft carriers, the cost of those aircraft carriers would take care of all reproductive health for all women worldwide. If you spent $5 per couple per year, you would take care of everything.
$5
per couple per year, pregnancy, mother and child, everything. Guttmacher Institute, I'm privileged to serve on their board, puts this out from time to time.
That's amazing.
Okay, and it's just that much. What's even worse is the fact that most of this is self-financed. What's even worse is that in a country like ours, a lot of healthcare is out-of-pocket expenses, and you can imagine what that does to people who are not able to really afford quality. So things have to be better, and we have to make them better. We have to demand this rather than being diverted by so many other issues. We have to demand the things that really matter to us.
But you know, one thing I want to say is there is a lot of romance around women being sacrificial. So you have all of these, you know, movies where you'll see that the woman is not eating, she's feeding her husband and her children first. Okay, but it's romanticized. And it's important to remember that malnourishment, anemia, these are not just phrases out of a boring medical journal. They actually impact your cognitive decline. They actually have an impact on your brain. And basically what we're saying is that women's brain development could be different from that of men because they don't have the same access to basic nourishment, basic vitamins. And I think we need to actually say it as starkly as it is, Dr. Sheriar.
Yeah. To just give you a kind of a different point from this, I tell my patients, today if a doctor tells a woman that your husband needs to get this particular test done, he'll have it done day before yesterday.
Yeah.
She'll see to it. If it's your children, you'll rush to the pediatrician the same day. But tell a woman, no matter how confident and educated she is, she will put it off till it's convenient for the people around her for her to do it. So let's face it, this sacrificial thing has to stop because for that woman to be effective, and that's what she wants to be, she first has to care for herself. What you just mentioned has another dimension. When a woman isn't well nourished, okay, now let's take it. We're looking from the woman's point of view. There's no doubt that women definitely need to take better care. Another thing I always tell my patients is, let's talk about menstruation.
Yeah.
You eat the same food your husband eats. He probably eats better than you, but he doesn't menstruate. That leaves you at a disadvantage every month. What are you doing about it?
Yeah.
Now, when anemia, which is a major problem in our country, and for a variety of reasons, nutrition, menstrual issues not being managed well, in that situation, not only is it inconvenient, it's also medically harmful. She is not only going to impact her own health, but she's also going to impact the health of her unborn child when she's pregnant.
Yeah.
So society, wake up. It's not just about the woman we are talking about, but it's about your future.
Yeah.
And that's something we know today, that when you have nutrition and the fetal growth being impacted, that fetus is going to grow into an adult. There's what we call as, today we talk about fetal onset of disease, hypertension, diabetes. If you don't get this right then, so you have a scientific justification for getting this right. Now, where do you start? Where do we start? We first of all start with everything around us. We first of all start with the people in your life. I mean, I see a young audience here. You've got people in your life, mothers, aunts, grandmothers. You've got to start by motivating those people because they come from that same old mindset of, I have to do everything for everyone else before I come to myself.
Yeah.
Yourself, I mean, you start right. You start right, you're going to have a great life going ahead. So please don't neglect your nutrition. Something as simple as bones, osteoporosis. You build bones till the age of 40, you spend the rest of your life losing it. Now, these are things which have to be out there, which have to be told, which have to be popularized. And I believe once you give the right information, people will start making use of it.
What is the most startling disparity when it comes to access to healthcare between men and women?
See, firstly, there has always been such a shocking disparity, and I'll tell you from the point of view of the medical profession and the industry. I always say that there are certain diseases which were traditionally men's diseases, cardiac, ortho. The maximum research and the maximum investment happens in those. The pharmaceutical industry always pushed those drugs because they believe that men, that's where they would make their money. For me, that's a startling disparity. There is a small glimmer of hope, and the glimmer of hope is in the last 10 years, every pharmaceutical company has opened a women's division. They don't do it for love of women. They do it because somewhere they realize that now this is the place women are going to start asking and coming into their own. Obviously, the biggest disparity has to be maternity and childbirth and the growth of the child. According to me, the biggest disparity is there because even today, mothers continue to die or suffer in pregnancy. And believe me, almost each and every one of those deaths is completely preventable. You know, we had a president of our international federation, Mohammed Fatala, who said that women are not dying of diseases you cannot prevent. They are dying because society has still not made up their mind that those diseases should be prevented.
Yeah.
So that, for me, that's the first thing, low-hanging fruit. No young woman should die giving birth to a child, which basically she's doing for humanity. Let's face it. Other things, for me, has to be reproductive health. Why does it have to hurt women more than men? Why do women have to take all the hit and the responsibility of pregnancy, of contraception, of deciding whether or not that child should come into the world? Why do people get to decide? Yeah. You know, Kamala Harris, when they were doing the hearing of one of the last Chief Justices of the United States, asked him a very simple question. Tell me one law which regulates the reproductive health of men. One law.
Yeah.
Why are there laws for women? Yeah. That's a disparity. Today, women are the third leading cause of death of mothers in our country is unsafe abortion. A country that had abortion for the last 35 years cannot allow a woman to die of this. Why does it happen? Because you're not giving her a free and a fair choice. The moment you did that, no woman would die of abortion anywhere in the world.
Dr. Sheriar, you know, Vinita Bali, who's sitting in the front row, she's the one who came up with this phrase, Renaissance men. And you are one, and we're about to introduce another one. But if I can request you to stand here and also call Harshini from GHS, one of our partners, if you can please come up. I think she's coming up right from here. Please come. Thank you. One last thing before I introduce our next guest, who is very much a Renaissance man. One thing you want everybody to understand about the disparity between men and women when it comes to healthcare that we don't know.
Midlife. It's not that men don't get impacted in midlife. It's a lot more insidious and slow. But for women, it's there. 50% of the world's population is going to be hit by it, and still we sweep it under the rug. Yeah. We tell women it's okay. You tell women it's natural. You tell women that you'll get through it. When you know the book which we talked about in the last We the Women, a woman once stood up in one of the events we were doing and said, I went to my gynecologist, wonderful person, brought my children into the world. I told him I was suffering. He stood up, shut my file and said, you know, dear, you'll have to put up with this for the next few years. It's going to go. Not acceptable. Midlife. You are going to spend the rest of your life after this midpoint of your life. And you owe it to yourself. And if you like to be, you know, altruistic to everyone around you, to take care of yourselves and have a good rest of your life.
Well, thank you for saying that. You've broken so many different taboos. And, you know, as I said, here's one Renaissance man, and I want to now welcome another Renaissance man, a man who I think is one of our most original thinkers, who I often call the most feminist, among the most feminist men I know. Lyricist, poet, a man of so many parts, you can barely count them. Can we please put our hands together for Javed Akhtar? Let's have a huge round of applause for Javed Saab. And Javed Saab, before we get into our conversation, we want you to present Dr. Sheriar, who does a lot of work in women in healthcare and has been a champion for women's health. And we were talking about the inequality between men and women when it comes to access to healthcare. And we are honoring him today, which, come, Javed Saab, if we may do the honors. आगे, Javed Saab, थोड़ा सा. Javed Saab, there's a startling statistic, Dr. Nozer. One statistic we want Javed Saab to think about.
The fact that, and I was talking about midlife. There's a young audience here, but I always say they've all got people in their lives who aren't getting the care they need. In the midlife, 50% of those women are going to suffer the consequences of midlife, the medical consequences. For 10%, it can be severe. For 5%, it can be incapacitating. And each and every one of those 5%, 10%, or 50% can be completely looked after if care, health care, other care, holistic care is made available to them.
So the
50% of the world's population.
Thank you, Dr. Sheriar. आप कुछ कहना चाहेंगे?
Dr. Saab, if my information is correct, the number of women who die of minor maternity complications in 1 week in India is higher than the women or the death of the women in whole of Europe for 1 year. In 1 year, they don't get that number which we get every week. Every week, it's like over a year, it's like 400 jumbos crashing with full of passengers. But it's no news at all. It's not a problem. We can afford to spend women like that.
Thank you, Dr. Nozer, for at least ensuring that there's a great invisibilization of these issues, but you have shone a light. We thank you very much. Javed Saab, if I can request you to take your seat. Dr. Nozer.
Thank you. Thank you, sir.
Dr. Nozer, please.